Scenario: an old man with difficulty swallowing. Hello, I am Dr. Ryan, one of the surgical doctors. May I confirm your name and age, please? Hi, doctor. I'm Joe, 65 years old. Nice to meet you, Joe. Today I will be your doctor. Are you okay with this? That's fine, doctor. How can I help you today? I have difficulty swallowing, doctor. I am really sorry to hear that. Analyze the main complaint using Socrates. Site, onset, course, duration, character, radiation, timing, severity, aggravating and relieving factors, and associated factors. Did this start suddenly or gradually? It was gradual, doctor. When did you first note this? 6 months ago, but I neglected it. Is there anything that makes this difficulty stop? No. It's constant. Is there anything that makes that difficulty increase? Yes, solid food. Do you experience this difficulty in swallowing solid or liquid foods or both? It was for solid food at first, but now even liquids are difficult to swallow. Differential diagnosis. 1. Ka esophagus. How has your health been recently, Mr. Joe? I feel so tired, doctor. Have you noticed any unintentional weight loss? Yes. How many kilos over how long? I am not sure, but my clothes are getting scary loose in the last 2 months. Have you vomited at all? Yes. Was there any blood? There were streaks of blood? How has your appetite been? Bad. I barely eat. 2. Guitre. Have you noticed any neck swelling or feeling a lump in your neck? No. 3. Pharyngeal pouch. Did you notice the regurgitation of food while lying down? No. Have you noticed having a bad smelling breath recently? No. Do you ever notice gurgling or a wet voice after swallowing? No. 4. Gourd. Do you ever taste acid at the back of your mouth? I used to have that when I was young. Any heartburn? Yes, sometimes. That must be difficult, Joe. Yeah, I am just trying to cope with all of this. I understand. 5. Achalasia. Have you noticed that difficulty is more to fluids than solids? I already answered that question. No, it's for solids, more than liquid. Yeah, I know. I just want to confirm. Have you had a fever? No. 6. Esophagitis. Have you noticed pain during swallowing? No. It's just difficult to swallow, not painful. 7. Autoimmune disease. Myasthenia gravis, scleroderma. Do you suffer from painfully cold hands? No. Any dry eyes or mouth? No. 8. Neurological disorders, UML. Have you noticed any weaknesses anywhere? Any problems walking? No past medical history. Did you experience similar symptoms in your past? No. Were you diagnosed with any medical conditions? Yes, I have, GERD. Do you take any regular medications? Yes, I take omeprazole. Do you have any allergies? I don't have allergies. Have you had any history of surgery? No. Family history. Does anyone in your family have the same problem? No one I'm aware of. Social history. Do you mind if I asked you personal questions, Mr. Joe? That's a fine, doctor. What is your occupation? I'm a retired primary school teacher. Who is at home with you? My wife and our youngest son. Do you smoke? Yes. How many packs/day? Around 2, doctor. Do you drink alcohol? Yes. How many units/week? Around 1. Do you have any difficulty with the stairs? No, it's fine. Idea, concerns, and expectation. Before I go any further, could I ask, what do you think the cause is? I am afraid of something bad. Don't worry, we will help you. What are you the most concerned about? Being unable to enjoy food. I understand what you are thinking right now. What are you hoping for us to do for you? Fix this issue, doctor, please. Systemic review, start from head to toe. Do you have a headache? No. Is there any chest pain, SOB, or cough? No. Any problems in passing urine? No. Any muscle or joint pain? No. Anything else you want to add? No, thank you. I'll discuss this with my senior and get back to you soon. Discussion. Present your patient. I took a clinical history from this gentleman, Joe, a 65-year-old male complaining of gradual dysphagia that started 6 months ago. Started with solid food only, but now even liquids are difficult to swallow. He lost weight and her appetite is constantly declining. He has a gourd for which she takes omeprazole. No family history of similar problems. He smokes 2 packs of cigarettes per day and drinks around 1 unit of alcohol per week. What are your differential diagnoses? 1. K. esophagus. 2. Esophagitis. 3. Pharyngeal pouch. 4. Achalasia. 5. Autoimmune diseases. How will you investigate your patient? I will do full clinical abdominal examination, including lymph nodes. Examination then, I will request bloods investigation, FBC, UNES, LFT's chest X-ray, esophageal manometry to exclude achalasia, barium swallow endoscopy, and biopsy esophageal endoluminal, US. Also for staging of carcinoma, gold standard. Video fluoroscopy assessing for aspiration. Staging CT scan, depending on what the previous investigations reveal. What is the best investigation of what you mentioned? Endoscopy and biopsy. How are you going to treat your patient? I will treat this patient in MDT. According to the investigation, I will determine is my patient operable or not if operable. Esophagectomy plus chemoradiotherapy. If non-operable, cases palliation. By 1. Self-expanding metallic stent. 2. Palliative chemotherapy and radiotherapy. 3. Feeding jejunectomy.